My name's Sarah. I'm going to be your nurse today. Today we're going to be doing a full head to toe assessment on you, okay? We will maintain your integrity by keeping this blanket on you, but if you do have any questions or concerns, feel free to let me know. Do you have any questions before we begin? Great. I'm going to wash my hands and we'll get started. All right. Well, let's get started. We'll first start with your name. Okay. And your date of birth. Great. Do you happen to know where you are? Okay. And do you know about what time of the day it is? Excellent. Okay. Awesome. Well, we'll get started. I'm just going to inspect your eyes. So if you don't mind, I'm just going to look at your eyelashes and your eyebrows, which seem very full. Looks very healthy. I'm looking at your sclera, your iris, your cornea, and then I'm also going to look at your conjunctiva. If you look up at the ceiling for me, I'm going to pull down just a tad. Perfect. Conjunctiva is pink. Our eyes are normal. We have no abnormalities of the eyes. All right. Next, I'm going to shine this little light in your eye, okay? In both of them. Awesome. Pupils are equal, round, and reactive to light in both eyes. Next, if you don't mind to just follow my little pen light. Accommodation is present bilaterally. Next, we're going to take a look at your ears, okay? If you don't mind, I'm just going to start with your right one. This ear is very round. Skin color is inconsistency with the skin of the rest of the body. We have no drainage, lesions, or any marks on the skin. And the same for the other side. This ear is also very round. There are no lesions, skin marks, or any drainage coming out of it. Our skin color is consistent with the color of our skin. Awesome. Well, now we're going to take a look at your mouth, okay? All right. Your lips are pink and moist, it looks like. And then if you don't mind to open your mouth, I'm going to take a look at your gums and your teeth. Great. Your gums are pink and look very healthy. Your teeth are white and look very clean. We have no missing teeth. On the inside, oral membranes looks very good, pink and moist. And then if you don't mind to say, perfect. We do have our little uvula is intact and it looks very good. Okay. Next, we're going to do your skin assessment. So if you don't mind, I'm going to pull your blanket down just a tad, down to your waist, okay? Excellent. And we're going to bring your arms out. Great. Okay. All right. And we're just going to inspect the skin. I see no lesions, cuts, bruises, or any abnormalities of the skin. Looks very good. Now we're going to check the temperature with the dorsum of our hand. Looks very good. We're going to check the front and the back of both of your arms and legs, and we will do your legs momentarily. All right, so skin is very warm and dry to touch. I'm going to check out your fingers now. There is no clubbing. Our fingers are round and pink. I see no abnormalities. I'm going to check your capillary refill, okay? Capillary refill is less than 3 seconds. If you don't mind to squeeze my hand. Very good. Strength is 5+ in both hands. And then I'm going to check your radial pulses. Excellent. 2+ bilaterally. All right, and we will check your carotids and your trachea alignment after we check your feet. So I'm going to cover you back up, and we're going to take a look at your legs and feet, okay? So I'm just going to uncover this just a tad, and just so everybody can see. Should be better. Yeah, okay. So we are going to look at, again, inspect the skin. I see no abnormalities of the skin, no lesions, bruising, cuts, insect bites, nothing. And I'm going to check the temperature again in the front and the back. On the other side, the front and the back. Excellent. All right, we have, our skin is warm and dry to touch. Excellent. I'm going to check your toes, and we are going to do your capillary refill down here as well. Excellent, less than 3 seconds. I'm going to check your pedal pulses. So about here, push, great. And then I'm going to check for pretibial edema, which means that I'm going to press about the front of your ankle, right where my fingers are, for about 5 seconds on both sides. 2, 3, 4, 5. Excellent, no edema noted. And if you could just push against my hands. Great, 5+ strength in the feet as well. I will get you covered back up, and I'm going to do some little hand hygiene because I did touch your feet. All right, and we're going to come back up to your neck and just work our way down again. So let's uncover you and put your arms over the blanket. And I'm just going to palpate your carotid arteries, which are right here, sorry. And I'm just going to grade them as well and see how strong they are. Okay, so we'll start in your left side. Excellent, 2+. And again on your right. Excellent, 2+. Okay, I'm going to check for some skin turgor. Skin does go back less than 1 second, very bountiful. Next, we're going to check your trachea alignment, okay? Great, great. Trachea is in alignment. There is no abnormalities of the neck. All right. Now that we're doing the heart assessment, I like to take my blood pressure now, since we're going to focus on the heart. So let's get you set up in a cuff. We're going to take a manual today. We are going to make sure that we put it in place to where we put our stethoscope 2 finger breadths above the antecubital space. Excellent. All right, and we are going to put our stethoscope, again, 2 finger breadths above the antecubital space, and then I'm going to inflate the cuff. Our blood pressure is 120/70. Very good. I'm going to get you unhooked. Excellent. Now, if you don't, are you comfortable with lifting your shirt up just a tad so we can check out your heart sounds? Okay. Let's bring those up. Excellent. And we are going to just look across the chest. I don't recognize any heaves or lifts. I don't see any when I look across the chest, but we will take a stethoscope and check in about 5 different areas 2 times with 2 different parts of my stethoscope. That doesn't mean anything's wrong. It just means that we're being very thorough, okay? So let's get started. So we're going to start in our second intercostal space on the right sternal border. That is called our aortic. Again, second intercostal space, left sternal border, that's our pulmonic. Third intercostal space, left sternal border, is our herbs. Left intercostal space, our fourth intercostal space, left sternal border, is our tricuspid. And then kind of mid-clavicular, fifth intercostal space, that's our mitral. And we're going to hold this and listen for 1 full minute, or apical. All right? And we'll count for 1 full minute. Excellent. Well, that was our full minute. Your pulse is 66 beats per minute. Very normal, very healthy. All right, and next we're going to switch over to the other side of my stethoscope, the bell, and we're going to listen to the same area, so we're just going to go all the way back up. So we're going to start down here, our mitral, back to our tricuspid, our herbs, our pulmonic, and our aortic. Excellent. No extra heart sounds noted, no murmurs, and no palpitations, no splitting. Our heart sounds totally healthy. It's very good. All right, and next we are going to check for our lung sounds and our breathing. So I'm just going to check. I see a symmetrical rise and fall of the chest, which is very good, and I'm going to measure. So our AP is about less than or about half of our transverse, which is good. Very good. All right. And I'm just going to look across. I don't see any abnormalities of breathing, but we are going to take and just listen to about six or eight areas on the front of the chest while you take deep breaths for me. I'm going to do one on the side, and then we'll do 8 to 10 on the back, and I will flip you around so our audience can see, okay? All right, let's get started. And just remember, every time I put this stethoscope on you, we're going to take a deep breath. Excellent. Well, let's get our lateral while we're at it. Okay, good. And then we will flip you over. I'll keep you covered up, and I'll maintain your posture for you. Great. All right, and we're going to check your back. Again, deep breaths. Excellent. So we did our 8 in the front, 10 in the back, and we will just flip you back over. I heard no adventitious lung sounds, no wails, crackles, or wheezing. Okay. You feel okay? You're doing good? Awesome. All right. Well, we will lay you back just a little bit, and next we're going to assess the abdomen, okay? So I'll pull your shirt back down just so we have our little belly exposed, okay? All right, let's bring our arms out, and I'm just going to look across. I don't see any peristalsis, any movement of the belly, which is good. I'm just looking straight across. And for the stomach, it's important that we listen before we touch, okay? So I'm going to listen to all of your quadrants, all 4 of your quadrants. Ready? Excellent. Bowel sounds are active in all 4 quadrants. They are normal active. I didn't really hear any abnormal sounds, okay? So next I'm going to palpate with one hand, and I'm just going to start at your right lower. I noticed no abnormalities, no guarding, or any difficulty with your palpation. And next I'm going to go with both 2 hands for deep palpation, okay? Great. No guarding, no organomegaly that I noticed. We're looking all good. All right, and again, we'll have you turn around for the camera, and we're gonna check out your back for one of our last things, okay? And I will keep you covered, but we'll have you stand up for this, okay? And I'm just gonna keep you covered, and I will just check out your back, okay? I'm just gonna palpate down the sides. Great. All right, and then we'll have you bend over, and then we are gonna inspect for any like abnormalities of the back. So there is no lordosis, kyphosis, or scoliosis noted in this patient's back. Okay, and we will get him back in bed situated, all covered up. Great. All right. Now that you're back in bed, are you comfortable? Okay, great. Do you have any questions for me? Okay. Well, that concludes our head-to-toe assessment. Your call light is in reach. You have one guardrail up, actually two. But if you need anything, just feel free to give us a call on your call light, and then we'll be back with you shortly. All right. Thank you.